what's the strongest lever to pull from an anxiety perspective based on all the things you tried. And you mentioned some of them: diet, sleep, hypnotherapy, meditation, etc. So I don't know if you could give that advice, like start here, what is it?
Yeah, 100%. Well, that's why I created a video course, and that's kind of the question I asked myself. There's all these different things, how to piece them together. So I split them into 3 sections. So the first section is healing, the second section is reprogramming, and then the last section is managing. So if you're just starting to feel like you're going through the anxiety journey, or you're feeling really overwhelmed, the first place you want to do is where you get the quick wins, the instant results, where you can manage it. So when you go to the managing section, where this is the day-to-day stuff, this is your ice baths, your meditation, breath work, all this kind of stuff. So ice baths are great because they increase your dopamine by 250%. That can last up to 3 hours. Contrast this to like a chocolate bar or something. You get the same increase of dopamine, but it lasts 10 minutes. So as painful as ice baths are, they're so good in this perspective. The next thing is anxiety works kind of like by fight or flight. A lot of the feeling you're getting is just a fight or flight response, where it's an increase in adrenaline. So ice baths then will increase adrenaline by 500%. So basically, you think it probably sounds bad at first, which I did as well, and then I kind of looked into it and did it myself. You get a 500% increase of adrenaline in that moment. So you're getting to the ice bath, your adrenaline spikes through the roof, but it's in a controlled environment. And then what happens is the rest of the day, when you feel a fight or flight response, your body's not got adrenaline to kind of go to. So you're getting like a really reduced amount of adrenaline, and therefore it's reducing the feeling of anxiety. So that's one thing. That's why I do ice baths or cold exposure every single day. And it helps like ridiculous amounts. It's guaranteed to feel good at the start of the day, basically. The next thing is meditation. And the biggest thing you can go wrong here is by doing it for and I'm going to do an hour straight away. It's just not going to work. It's too much focus, and you're going to find yourself just wasting your time, basically. Just start off with 5 or 10 minutes and search up. Obviously, you can't go through it now, but it's mindfulness meditation. Essentially, it's closing your eyes and just focusing on something. Usually, it's your breath. Just keep focusing your breath. You will think of things. Thoughts will pass. Just notice them. Let them pass in your mind. I just think of the word thinking, and then I go back to the breath and just keep going back. And eventually, after time, in those 5 or 10 minutes, you'll realize that you're not getting these thoughts come up, and then you'll be able to do longer and longer and longer. So I do 15 minutes. I'm going to try up to half an hour soon. So that's that. Breath work is also another thing. So if you look at box breathing, that's really good for coping when you're feeling overwhelmed in a moment. So say you're outside, maybe you've got social anxiety. Breath work like box breathing is really good to just reduce yourself. I will say oxygen. Oxygen is kind of like similar to a fire, the way it works with us. So if you've got oxygen with a fire, it accentuates the fire. If you've got oxygen when you're feeling panicky, it's going to accentuate the panic. So by breathing and slowing down your breathing, you're suffocating your body of oxygen, and then it's forced to reduce your heart rate. I think it's through the vagal, I think it's called the vagal vagus nerve, and then through the reduction of the heart rate, you then feel calm again. So you can't be panicky with a low heart rate. You can only start panicking with a high heart rate. So if you control the heart rate, you control the panic. So that's the managing aspect. The next thing you want to look at, and this is the biggest thing, is why you're feeling like this in the first place. So a lot of the time it can be trauma. For me, it was drug-induced PTSD, which was from the experience I had on the weed brownies and kind of stuck. And this is when hypnotherapy was really, really good, because hypnotherapy taught me how the mind actually works. What we'll do is we'll take snapshots of our scenarios and we'll associate them with emotion. So for instance, say 30,000 years ago, we're hunting a tiger. We see a tiger get absolutely mauled. We get mauled by the tiger, but we managed to survive. Our brain's taken that memory and associated it with loads and loads of negative emotions to protect us, essentially. So that when we see a tiger again, we don't think, oh, we're going to go hunt it again because it's going to kill us. So as a use of survival, our brain then goes, no, this is what happened last time. It goes through the file and catalogue of memories, realises this is what a tiger done to me, and then it paralyses you in anxiety. So as a form of survival to keep you safe, that's what it does. So now we know it's just kind of a survival mechanism. Now we've got to try and see how can we process these emotions properly. This is like EMDR therapy. EMDR therapy is so good for these situations because the way EMDR therapy works is it manually processes these traumatic memories. So when you have a good memory, say you go to a theme park with your parents, you love it, that memory will just join the network of memories. You'll have some dreams about it the next few weeks and it joins their good network, happy days. But when you have a negative scenario, so say like with the tiger, it quarantines that memory. So as a form of protection, your brain goes, right, I'm going to put this memory over here, away from the good network to protect you. So the issue is you feel fine until you see that tiger again. It feels like you're reliving that experience. So it'll just suddenly go bang and it's fresh. And that's why when you have like PTSD, it feels like you're really reliving it again. So EMDR therapy is really, really good for processing that memory manually. So what it does is kind of unblocks the drain. So it's so bizarre. It works by the bilateral stimulation of your eyes, and it's thought to replicate REM sleep. So you kind of go to somebody, a doctor or whoever, whoever's trained in EMDR therapy. You'll think of the memory. You engulf yourself in it, feel those emotions like rife. They'll literally move their finger like this, just left to right, and you'll keep your neck still, and you'll just follow it with your eyes. So it's the bilateral stimulation of your eyes. So you just keep following it. You'll do this 20 minutes, about 6 to 12 sessions, and then your brain will process that. It kind of unclogs the pipe, so your brain then kind of processes the memory, and then it starts doing its own processing. So when you unclog the pipe, the water will go through and start getting filled essentially. So the next 2 weeks you'll have nightmares, but that's just your brain processing the memory. And then what you'll find is that you could think back to the tiger situation, and all of a sudden when you see a tiger, you feel nothing. You don't feel paralyzed, you don't feel any anxiety, you just feel fine. And this is a lot of the time what's causing the anxiety that we're not aware of. It's these little traumatic memories kind of we've picked up throughout our life that haven't been dealt with. So EMDR therapy is great for that. Hypnotherapy is great for kind of reprogramming like the way you feel about things. It basically puts your brain into theta state. So a trance that you get put in is basically just theta state. It's when your brain waves go between 4 to 7 hertz. So basically you can speak to your subconscious. Your subconscious is a lot more susceptible to listen to. It's a lot more susceptible to be spoken to. So things that you say really stick. So hypnotherapy will put you in a trance state, theta state, and then the hypnotherapist will start saying things like affirmations or things you want to feel so that you can really start believing that. So say if you go to hypnotherapy and you get put in a trance, they could say, you feel good. Say you're trying to quit smoking, you'd be like, you don't like smoking, you realise that it's not worth it. Your subconscious listens to this, and then that will really help with your day-to-day life too. And that would be the healing way. And then the reprogramming is essentially the convincing, it's throwing yourself now into the real world and then kind of like reprogramming on the basis of what you've done. So say you've now healed, you've still got to kind of say, like for me, I didn't like driving far away. So say I've now healed from hypnotherapy or EMDR therapy from driving far away, but now I've actually got to go do it. So I go do it, and like my brain I'm used to those negative emotions, so I'm kind of looking for it. But through kind of the self exposure therapy, through doing it like over and over again, you kind of then learn to relearn that it's okay. So you do reprogramming, it's like self-hypnosis. So kind of telling yourself things over and over again. Again, your subconscious listens to everything you say. So that's why you don't want to have any negative self-talk. Exposure therapy, so going and doing the thing you don't like doing over and over again. There's something I call a Foster-based questioning, which is my own kind of technique that I developed when I was driving far away. I realised when I could feel a panic attack coming on, I could defeat it with logic. So the reason we feel anxious is basically, if you think about anxiety, it's just the fear of something that hasn't happened yet. And we only feel fear as a protection from death. So the question is, if you're not in danger and you know you're not in danger, there's no reason to feel anxious by extension because you're not in danger of dying. So I'll be driving and I feel anxious and I can feel myself getting a panic attack. So I'll use all the thought I can muster up and just ask myself a closed-ended question. And the first question is always, am I in danger? And when I look around and be like, okay, I'm driving, I'm not in danger. Okay, no, I'm not in danger. So I feel a bit better. So I'm like, okay, right, let me ask another question. This is another closed-ended question, but it's more specific to your scenario. So mine would be, I'm driving, I love camping. So I'd look around and be like, would I camp here? It's all countryside in the UK. So I'm like, look around, yeah, I would camp here. I've got a tent in the car. And then I'm like, okay, I'm safe. If I'm not in danger and I'd camp here, I could pull over and just relax at any point. And that's how I deal with it. So that's my own one. But yeah, so you've got healing, reprogramming, and managing. And then they all have their own little framework.
No, I think it sounds like you have a great system. And one thing I want to call out too, because you mentioned a lot of these things, but I think, the stuff you do on your own, whether it's like breath work or meditation or changing your diet or better sleep, I think, and let me know if you agree, this is something you're going to be doing essentially like in perpetuity. So make sure it's one, sustainable, and that there's balance. But like, you can't just say, okay, I'm going to meditate a couple times and then I'm going to be good to go. Right. Like it's
100%.
kind of like a forever thing. Right. Do you agree with that?
Yeah, it's your lifestyle now. So the managing part, yes, I should probably should have said the managing part of this is your lifestyle. This is your day to day stuff, and yeah, you can't just do it one time. You're kind of the best way to look at it is your brain as a muscle. So when you meditate, you're essentially training the muscle. It's like going to the gym to train arms. If you go to the gym a few times a week, maybe leave it for a few months, do you think your arms are going to grow? They're not. They're going to kind of, maybe you feel a bit of a pump and then they'll stay the same. But if you go to the gym every single day and just do, say, 20 minutes on arms every single day, by the end of that year, your muscles, it will be bulging. If you're having the right foods, it'll be really big. So it's the same thing with the brain. If you just meditate every day and just keep it up, like say 5, 10, 30 minutes, and then you just stay at 30 minutes every single day, your brain's going to be so strong now and so kind of well formed, that is, yeah, it's be so powerful, and it's definitely something you need to do day to day. Same with the kind of the ice baths. If you can maintain the ice baths every single day, then you're also guaranteeing yourself, a strong start to the day as well. Um, the EMDR therapy stuff and the hypnotherapy, that is a bit more complicated,
Mm-hmm.
and you don't really. That's not something you do day to day. That would be something kind of, obviously you want to go through kind of like the person you're doing it with. EMDR therapy, they need to be trained in. Hypnotherapy, it's not so much. But that would be something kind of you'd do once a week, and then once every 2 weeks, and then once a month, and because that's something that's it's healing you. It's not meant to be there all the time. But the reprogramming stuff is self hypnosis, like affirmations. That's something you need to practice doing every day. So it's just positive self talk. It's only going to improve you more, improve your mindset more. And exposure therapy, like I do find this, if you push the boat out, you can keep pushing it further and further and further. But when you do stop pushing the boat out, it does seem that the boat starts to come back in a little bit. So, for instance, I drove somewhere 4 hours away, and I felt like I already pushed the boat out. Then I flew somewhere, then I flew to another country, and I felt like really strong. And I was like, I could go to like another continent, whatever, I'd feel fine. I left it about a year, and then all of a sudden, it felt like a bigger challenge now to even just drive 4 hours away. So you have got to keep maintaining these things and kind of exposing yourself to your wants, fears, so they don't come back in.